Hello, my name is Samuel Robinson, and I'm a graduate student at Johns Hopkins University, completing a practicum at the Maryland Department of Health and Mental Hygiene Center for Chronic Disease Prevention and Control. Before we begin, here is the mission and vision of the Prevention and Health Promotion Administration of DHMH. Healthy retail directly aligns with our mission, since nutrition is integral to health, particularly in chronic disease prevention. Because diets high in sodium, calories, saturated and trans fats have been associated with conditions such as obesity, hypertension, and type 2 diabetes. By addressing worksite nutrition, the Prevention and Health Promotion Administration is improving health and well-being for employees across the state of Maryland. The target audience for this video series are Healthiest Maryland Businesses, or HMB coordinators, in the hopes that they will share food environment intervention strategies with HMB partners. This webinar series consists of 5 short videos that aim to assist individuals looking to implement initiatives to make food retail environments healthier while still remaining profitable for the retailer. The first video in this series aims to give a brief introduction into healthy retail, its role in public health, and an overview of the strategies that will be covered in this series. Our learning objectives for this video is for viewers to be able to identify types of food retailers, to understand the impact food retailers have on the dietary behaviors of consumers, and comprehend the marketing mix and its application to encouraging health-promoting behaviors. First, let's define what we mean by food retailer. For the purposes of this video, a food retailer is any venue that allows consumers to walk freely and survey their options for food prior to receiving and consuming it. Note that this is a broad category that can include grocery stores, convenience stores, and cafeterias, to name a few, some of which are likely to be found within a mid to large size worksite. The key point here is that these are places where you typically purchase food that is selected, placed, and promoted in strategic ways to generate profit for the business owner. This differs from sit-down restaurants, which you'll notice are excluded from this list. That's because there are a limited number of strategies one can implement in a restaurant besides menu design and pricing. I wanted to highlight areas where many strategies can be utilized in combination with each other, and you'll see how that will play out over the course of this series. Food retailers clearly play an important role in shaping public health, since these are the places where we encounter our dietary options, where we make food choices multiple times a day. Although this presentation focuses on work sites, food retailers are found within the places we work, within hospitals, schools, and the larger community. Therefore, if we can transform these places to help us make healthier food choices, we can begin to see reductions in dietary behaviors that lead to chronic diseases, which contribute a tremendous burden on our healthcare system. The 2015 Dietary Guidelines for Americans advocate for decreased consumption of saturated fats, sodium, and added sugars, and encourage whole grains, lean meats, fruits, vegetables, and low-fat dairy. We can leverage food retailers to help consumers make the healthier choices outlined in the dietary guidelines to improve community health without compromising the profitability of retailers. I'm now going to focus on worksite food retailers as an example of the potential impact healthy retail strategies can have. Healthiest Maryland Businesses, or HMBs, is an initiative in which the Department of Health and Mental Hygiene partners with local businesses across the states to improve employee health. Since most individuals spend 2/3 of their waking hours at work, it makes sense that they would get hungry and/or thirsty throughout the workday, and employers would be wise to provide the resources to satisfy employees. However, food eaten away from the home tends to be higher in calories, sodium, fat, and added sugar. But according to a 2010 study, improving the types of foods and beverages made available at worksites led to overall improved eating behaviors and weight loss. This is highly encouraging and suggests worksite food retailers have the potential to make a sizable impact on population health. If we're going to be looking at worksite wellness, we need metrics to use for evaluation purposes. The Centers for Disease Control and Prevention's Worksite Health Scorecard, which some of you watching this video may be familiar with, is used to assess worksite health promotion initiatives, identify gaps, prioritize high-impact strategies, prevent chronic disease, and overall maintain a healthy workforce. This slide shows what the scorecard looks like. The scorecard is broken into sections, and this shows the 13-question nutrition section, which asks basic yes or no questions about the food environment. The scorecard uses an all-or-nothing scoring system, meaning a no receives 0 points while a yes receives 1 to 3 points, depending on the impact of the question. For example, providing employees with preparation and storage facilities is worth 1 point, while subsidizing or providing discounts on healthier foods and beverages is worth 3 points. So how did Maryland fare? Using the most recent scorecard data, 80% of businesses reported providing places to purchase foods and beverages at work. Of these businesses, 40% reported having a written policy or formal communication that makes healthier food and beverage choices available. When we break this data down by region, we find that the proportion of food-providing HMBs that have formal healthy retail policies ranges from 27 to 49%. Of note, no region has achieved greater than 50% of its food-providing HMBs drafting formal healthy retail policies. The CDC scorecard results for healthiest Maryland businesses suggest improvements can be made if more businesses created healthy retail policies that make low-cost, minimally invasive strategies sustainable and enforceable. I'll refer to these strategies as the low-hanging fruit of healthy retail. These are the types of interventions that business owners will be most receptive to, and can be divided into 3 categories within a business concept known as the marketing mix, a combination of variables used by businesses to increase their sales of goods and services. The marketing mix elements I will be focusing on in this series are product, place, and promotion. Here are just a couple of examples of elements from the scorecard that show how using the marketing mix can lead to higher nutrition scores. We can target product interventions to make healthier foods and beverages more prevalent within retail environments. We can also use promotional strategies to emphasize why certain products should be encouraged. Ideally, we would want to use both. The next 3 videos in this series will explore in more detail how product, place, promotion, and policy can be adjusted to create healthier retail environments with real-life examples. It is my hope that, if you're watching this and are interested in implementing healthy retail, you'll find some evidence-based ideas to use as a starting point, and perhaps even develop your own strategies tailored to the retailers that you're working with. This concludes the first video in this series. Thank you for watching. For more information on Healthiest Maryland businesses, please contact the HMB State Coordinator at DHMH Healthiest Maryland at maryland.gov or call 410-767-5079.